Hello everyone, this is Blanca Pacheco, Mayor of the City of Downey. Today we have the pleasure of being here at PIH Health Downey Hospital, and we have the pleasure of having Richard Trogman, the president of the hospital, who will be providing you vital information for yourselves and for your loved ones. So I'm going to pass it on over to Mr. Trogman, who I actually have my first question for, which is, what are steps that we are doing here at Downey PIH to protect patients in the community?
Sure. First of all, welcome, Mayor, to PIH Health Downey Hospital. It's great to see you again. Just want to remind everybody that it is a safe place to be at our hospitals. We've done a variety of things. First of all, we've been working hand in hand with the Center of Disease Control, with the California Department of Health, LA County Department of Health. We have our own expert team of infection prevention people who are well trained in how to deal with situations such as this. You know, we deal with infectious disease on a daily basis in hospitals well before the COVID situation started. But we've been in contact with the right people, understanding what the clinical guidelines need to be and how to take the best care of our patients. As far as protecting staff, physicians, and our visitors and patients, we have screening of anybody that comes into our building. Our own staff and physicians are not allowed at work if they have any symptoms. We provide a mask and hand washing to everybody walking in the building. As far as those patients that are infected, we keep them in a separate part of the hospital from the general population to make sure that we're doing our best to isolate those patients that are infected with the COVID virus.
And how are patients receiving treatment?
So again, that's those that are infected with the COVID virus. They're getting the care that they need based upon the severity of their illness. We have obviously the most intensive patients in our ICU, those patients that need mechanical ventilation or on ventilators. We have other patients that are on a floor unit. All these units are closed, and only those that are infected or suspected of infections are getting care in those units. We also have a new unit that we just opened up for ambulatory surgery care, where we have patients that can go into a setting where they know that they're safe because they're being tested. They're being screened actually before they come in. They're called on the phone during the week of their procedure. Then they come in the day of, they're screened and tested, and to make sure that they're in a safe environment to get their surgical procedure or diagnostic procedure. You know, we've had almost 500 colonoscopies, for example, that have been deferred between our Whittier Hospital and Downey Hospital because patients have been canceling these vital procedures. We want to make sure that the public understands it's time to come back in for your critical medical care.
The other topic that I want to touch upon is the PPEs. I know for a while there was a concern that we did not have enough PPEs for the hospital. How are we in regards to PPEs, personal protective equipment?
Yeah, of course, that's been in the media since the beginning of this crisis. Fortunately, here at PIH Health, our supply chain team has done an incredible job of making sure we've had the supplies we've needed. Our nurses, our clinicians, our staff have been protected since day one. We have not run the risk of being severely short or even out of any of those critical pieces of equipment. I would say it's been inconsistent over time. Some weeks we've had a lower amount of certain supplies, and other weeks it's other supplies, but overall we've not been in shortage. So we're very fortunate here at PIH Health that we've had the amount of supplies that we need to take care of our patients. That's not been the case in other parts of the country, as you know from watching the media. We've also had donations from the community, which has been incredible. Great support from everybody who wanted to help out and donating some equipment. But fortunately, we've been very good as far as our supply levels.
And what happens if people want to get tested?
So, as you know, fortunately, LA County is providing free testing. There are these drive-up testing sites, mobile testing sites throughout LA County. They have to go online or call 211 if they don't have internet access, make an appointment, they get a registration number, and they're assigned to their local testing site. PIH Health, we're sponsoring 3 sites at the moment. One at our Good Samaritan Hospital in downtown LA, one in our Whittier Hospital, and then in the city of Bell, just down the street. Those are the three testing sites that we're supporting the LA County Public Health Department.
My last question, is there anything that you want to tell the members in the Downey community who are watching us, what kind of concluding remarks you want to give?
Yeah, thank you. What's most important to me is to thank the community, the city, who have been so supportive in our efforts. You know, our staff, our physicians, they're all 100% focused on getting us through this crisis and taking care of patients, that we kind of forget there's an outside world there. But our community has been incredibly supportive in all sorts of donations. We get food donations every day. We've had supply donations, working with the Downey Unified School District. We've had support from all different sectors of the community. It's been incredible. It's a huge boost for our morale. Even the Downey Fire and Police Department doing the Heroes Drive-Through. Again, we kind of forget that there's a world outside these four walls, and our community has been incredibly supportive and really uplifted the spirits of our employees and physicians. So I want to thank everybody for that tremendous support that we've had.
I just want to thank you for taking the time and talking to the members of our community, letting them know what they can do, giving them factual information. I know you and I have been in constant communication, talking almost sometimes on a weekly basis, and at the beginning on a daily basis. So I appreciate this partnership that we have with you. I appreciate everything that you've been doing in our community and keeping everyone safe. To you, to our doctors, to our nurses, to everybody working here at our hospitals, you are all truly making a difference in the lives of our community. So I want to thank you, and I want to thank the members who are watching us today. Thank you for joining us, and be safe.